You guys have created a beautiful place here. I mean, I come here for massages, love the massages. What else do you offer here that might be a resource to our members?
One of the things we started a few years ago was the use of platelet-rich plasma for joint repair. And when you have a problem with a knee or a shoulder or an elbow or a wrist or a hip, and it requires treatment more invasively, you have really three options. Let's take knees, for instance. You can use cortisone, steroids. You can use hyaluronic acid or Synvisc, or you can use platelet-rich plasma. And having had a number of years of all of these under my belt, what I can tell you is that the platelet-rich plasma is the least expensive, the most natural, and in my opinion, it works the best. Recent studies comparing steroids versus PRP, platelet-rich plasma in the knee, showed that the PRP works a little better. The interesting thing that it showed for me, though, is that the steroids did not deteriorate the joint as much as we've always thought. And I think that makes it so that if someone has had a better experience with a steroid, we can use that. But the plasma, the technique is we draw blood into a sterile tube, spin that sterile tube in a centrifuge, and then draw the plasma layer, which is cloudy because we spin it to leave the platelets intact, into a syringe and inject that sterilely into the knee. Now, that's not to be confused with stem cell injections. They're very controversial, and there can be a lot of side effects. One of the biggest reasons for side effects is it's not always stem cells from your body. Sometimes it's cord blood. And the second thing is it changes hands a lot during preparation. It goes from one place to another, to another, to another, and the sterility is often not as good as it could be. So we see infections a lot more commonly. The technique we do with the PRP is as close to foolproof as you can get.
I think that's pretty amazing. I don't know about some of the members that are going to be watching this out there, but I love the most natural. And it's not very often that the most effective is also the least expensive, so that's a great combination as well. So, very good.
I probably could charge for your blood, but I feel bad to do that.
Right. So I want to thank you for your time today.
Thank you, Travis.
Thank you so much. Guys, I encourage you to get over to Ageless. We're struggling with lots of different things. It's not a one-size-fits-all. If you're curious about what your metabolism is, if you're struggling with joint issues, if you want to work on your skin, which is the second largest organ, I learned that today, so many different things, so many different solutions available to you. Make sure that you explore them all because it's not a one-size-fits-all. And thank you for what you're doing. Thank you so much.
Thank you.